Thanks for having me. I'm here today to talk about oral antiviral therapy for COVID treatment, and hopefully we'll answer a lot of your questions and give you some good information on how to answer patients' questions that may call in the triage or pharmacy regarding side effects and some additional information. Start out by talking about how they work. We have two different oral antiviral therapies we order for COVID patients. One is the molnupiravir, and the other one, the Paxlovid. The molnupiravir works by incorporating into the RNA strand, causing errors during replication that render the virus non-infectious and unable to further replicate. Paxlovid, it works by, it inhibits an enzyme that is needed to make a functioning virus during replication, so that the subsequent virus that is made is unable to enter a non-infected cell. So really both of these, the different mechanism of actions that these medications work by, really help stop the replication process, and that keeps the viral load down. So keeping that viral load down is really what prevents patients from getting severe COVID and needing to go to the hospital. So if you do get calls into your triage for the nurses, or pharmacists can always tell patients, these medications work by helping keep the amount of virus in your body down. And that is what helps prevent severe COVID and hospitalization. Next, we'll get into the side effects. And there are some overlaps with this. In my practice, the molnupiravir is better tolerated than the Paxlovid, but Paxlovid is also well tolerated. And I tell patients this up front, and you may be getting calls in, folks saying, I'm worried about taking these medications, but it's safe to tell them that for the most part, they are well tolerated. But these overlapping ones, really the diarrhea and the nausea. And then there are some reports for dizziness for the molnupiravir. So we'll start with some of the overlapping ones with diarrhea. And this is tough because diarrhea is one of the side effects from COVID. It can cause that. Sometimes it's hard to tease out, is it from the medication itself that we've started, or is it really a side effect that the patients are part of their symptom presentation from having COVID? But the advice we can give patients, we can advise them to really try to drink fluids, keep their fluid intake up to help replace those fluids that they're losing from their diarrhea, and try to stay hydrated. And then really talk to them about the food choices they're making. If they're eating well, try to avoid fried food or high fat food, and then also avoiding spicy food. I advise patients to really make food choices that are more bland, rice, broths, stuff like that, that is going to be easier on their stomach to help with the diarrhea. But again, it was with the Paxlovid, 3% of patients in the study group in the literature, 3% were taking Paxlovid and 2% in the placebo group. So you can see that really the difference there, there is some, but it might be from their COVID itself. Then we can talk about the most common thing I hear about, and in the literature, about 6% of people experience this, is the taste change. This is the most common thing I get asked about with patients, and it's caused by the ritonavir part of the medication. It's a member of the protease class, and they're historically known for causing a taste change in patients. Often described as a metallic-y taste in the mouth, but I've also heard, bitter, sour. And I tell patients that this is common, first of all, and then secondly, it will go away after you're done with the course of medication. But up front, when patients ask about what side effects may I or can I expect from this, I tell them about this, and I say it's not just when you're taking the medication itself, but can also be present in between doses. But things that can help with this, certainly chewing gum, and also like sucking on hard candy, but always caution patients that are diabetic because their sugars can be up because of having a viral infection, but also if they're sucking on sugar candy all day. So you can opt for sugar-free with this. Chewing on some mints can help. Sucking on ice and then drinking plenty of fluids can help with this kind of nasty taste they can have in their mouth. And then really more frequent oral hygiene, brushing your teeth more often, using mouthwash throughout the day can help with these symptoms, because really want to advise a patient to continue the medication, that this will go away, and having a bad taste in your mouth for a few days, the benefits of decreasing the risk of you developing severe COVID and needing to go to the hospital outweighs having a nasty taste in your mouth for the duration of this therapy. Lesser reported side effects, myalgias. Again, is this from COVID? This is one of the more higher reported symptoms when patients present with COVID. The literature says in the Paxlovid group was 1%, and the placebo was less than 1%. Over-the-counter medications, Tylenol can certainly help with this, and maybe some NSAIDs. But again, you got to be careful with liver and kidney function with both of those. And then hepatic function. When this was studied, there were some, it's not commonly reported. It's not a common side effect, but there was reports when they studied this that patients can experience a bump or elevation in their liver enzymes. It doesn't, some slightly elevated liver enzymes or hepatic enzymes don't preclude me from ordering this for patients. I will ask them to follow up with their PCP and send a message to them, or I will order some labs in a week or two after they're done with therapy to make sure that they're not continuing to uptrend. But I have that discussion with the patients when they ask about it, because they do read online. So we discuss that before, or if they call in and are concerned about that, it's important to, when we're triaging and doing these symptom-based calls with patients, to ask them, are they experiencing, jaundice, yellowing of their skin, yellowing of the whites of their eyes? So those would be important questions to ask patients that call in concerned about, is this medication affecting my liver, or I have liver problems and I started taking this? And then would be important to ask them, did you disclose to the provider that ordered this medication for you that you do have some liver dysfunction? And then I want to talk about some additional information, or sometimes we call these pearls, things we should know about these medications that you may get calls into triage about. The molnupiravir, we don't use that in pregnancy. It's not approved, been shown can cause fetal harm. And then, unlike the Paxlovid, the molnupiravir, it's not approved for patients less than 18 years of age. So if you get a call in the triage, say, can any of these be ordered for my kid? The answer is no for molnupiravir. It's concerned for bone and cartilage growth. And then if you do get calls asking about reproduction, this should be discussed up front by the provider, but women of childbearing potential, they need to either abstain from sex or use extra protection during therapy and 4 days after. And then with men, it's longer. Men with reproductive potential, they need to abstain from sex or use extra caution during their therapy and 3 months afterwards. So I always have this conversation with men up front, and ask them if they are trying to reproduce, and if they are, maybe this is not the best choice of drug for them. And then Paxlovid, patients might call and ask about the safety with their kidneys. It does need renal dose for a GFR less than 60. And it's important to tell patients because the medication comes in prepackaged often. Here in the States, it certainly does. And it's, there's a one for day and one for night, and it comes with all the medication. And since they are prepackaged, a lot of pharmacies don't have the renal dosing of this. So I send a note to the pharmacy saying, please be advised that I did order the renal dosing of this. And I also let the patient know that it may still come packaged with 3 pills for night and 3 for day, but they should only be taking 2, 1 white pill and 1 pink pill. So they're not taking more than they should be, but it should be instructions from the pharmacy, but I'd like for the patient to hear that as many times as possible. And then we're not ordering this for patients with a GFR less than 30. And do you need a chemistry before taking this? The FDA here in the States says if the patient doesn't have any history of renal or liver dysfunction, we don't need a test. Some providers will put an order in for some labs and then send me a referral so they can come back and I can review them while I'm screening the patient. But not a total contraindication if they don't have labs and they don't have a history of renal or liver problems. And my triage nurses certainly get a lot of calls about this medication, the Paxlovid, and the drug interactions. I would make sure that I tell the patient that there are a lot of drug interactions and it needs to be discussed by their provider when considering ordering this for them. And make sure that their med list is up to date and it's reviewed by the provider that's ordering the medication. Because a lot of the side effects that can come are from drug interactions. And then both of these medications, they're twice a day for 5 days. The molnupiravir is 4 tablets and the Paxlovid's 3 twice a day. And I hope this was helpful. We do get a lot of calls about these medications and side effects that they have, but also just other general questions I think hopefully we addressed here with this presentation. But appreciate your attendance and happy to answer any questions you might have.